Welcome to the series seminar video tutorials Germanische Heilkunde by Dr. Gerd Hummer, MD. My name is Helmut Pilhar. I am the father of Olivia, and Dr. Hummer's appointed lecturer on Germanische Heilkunde theory. Conventional medicine admits that it does not know the cause of any disease, so its therapy is inevitably experimental. Can cancer be inherited? Are there any carcinogenic substances? Can diet, not smoking, and exercise protect you from cancer? Has conventional medicine really increased our life expectancy? What does conventional medicine think about metastases? What does conventional medicine know about the causes of cancer? Where does it get its knowledge from? From statistics and animal experiments. Is it a science at all? Where does chemo come from? The fatal effect of morphine. What does the shock of diagnosis do to the patient? The objective is to understand where conventional medicine gets its knowledge from, and from which considerations it acts. A notice, I am not a therapist. At the moment the motto because of the current system is, get it yourself, or stay in conventional medicine. You can learn more about this in the approximately 1.5 hour seminar video. Ladies and gentlemen, I welcome you to this seminar video tutorial of Germanische Heilkunde by Dr. Gerd Hummer, MD. My name is Helmut Pilhar. I am the lecturer appointed by Dr. Hummer for the Germanische Heilkunde theory, which is a great honor for me. Initially, I was an engineer. I graduated from the Higher Technical School for Electrical Engineering and a second time for Mechanical Engineering in Wiener Neustadt. Ultimately, I worked as a software engineer. Since 1990 I have been married to my wife Erica, with whom I have 4 now grown-up children, and we have also been grandparents several times. Due to the cancer of our then 6-year-old daughter Olivia in 1995, we ended up seeing Dr. Hummer and got caught up in a medical battle that continues to this day. Since 1997 I have been teaching the biological laws of nature, discovered by Dr. Hummer. Dr. Hummer sadly left us in 2017. But he left us an important legacy. In my opinion, there is no more important knowledge than this. The knowledge about the correlations of how our body and our psyche work. What could be more important than knowing how our bodies function? How do diseases arise, and what should I do for it to disappear again? What does materialism bring me, when I am physically and psychologically ill? Nothing. Right? But it also shows who our friends are and who our enemies are. And also that we are often our enemies. Dr. Hummer has made himself immortal. Still in 1,000-year people will read what Dr. Hummer has written. The topic of this seminar video tutorial. The therapy in conventional medicine. My objective is to show the difference between the known methods and the Germanische Heilkunde. Of course, conventional medicine is known, but it is not questioned. I would like to question that, and then put things right from a Germanische Heilkunde point of view. This may sound a bit arrogant, but I am convinced that Germanische Heilkunde is correct. Simply because it has been confirmed again and again, and has never been refuted. I have experienced it myself with my own body several times, that it is correct. To be honest, I'm just amazed at how precisely it all works. I assume that Germanische Heilkunde will eventually be the norm, and conventional medicine will be a supplement. We don't want to banish conventional medicine completely. It does phenomenal work in emergency medicine. But when it comes to diseases that arise on their own, such as cancer, chronic diseases, allergies, and psychoses, they have nothing, they know nothing, and they can do nothing. And they have been doing that for more than 100 years. We could say that it owes its reputation to emergency medicine. Anyone who criticizes conventional medicine in our society is immediately viewed with suspicion. Everyone wants to leave loopholes, so that they can go to conventional medicine. For me, of course, the situation is not so simple, because if I need something, for example in a traffic accident, then I have to go to conventional medicine. So, we don't want to banish them entirely, either. That's the place where they really achieve something, where they are professionals. They can reattach a severed finger, so you can use it again. Or with cataracts. They replace them, and in 1 to 2 hours, you can see like an eagle again. It's amazing what they can do. Also, the medications. Sometimes medications are necessary to make survival possible. Or to make life possible at all. Let's say someone has diabetes, he needs insulin. Or if he doesn't have thyroid tissue and it stops growing, he needs replacement hormones. We also need high-tech medicine. A computer tomograph is a high-tech device. We would need 5% of conventional medicine. But surgery alone will not solve my conflict, nor will medication solve my conflict. Nor will diagnosis by brain CT solve my conflict. But as complementary medicine, it can keep its right to exist. We can lick our fingers at the fact that we also have this conventional medicine. But where they can't do anything, where they actually make us sicker and sicker, where they're not interested in the causes at all, that's where they have to get out. There, it is simply a question of business. The turnover of the pharmaceutical industry is 7 times as high as that of the weapons industry. And the weapons industry is not a small industry. However, I am not only concerned with conventional medicine, but also with other forms of therapy such as homeopathy, family constellations, kinesiology, and so on. To make the difference clear, for me as a non-therapist, as a non-medical person, it is not about denouncing other therapies. My concern is to show what the deficiency is, and what Germanische Heilkunde can offer. For example, the very big mancho, we in Germanische Heilkunde have 3 levels. The psyche, the brain and the level of the organs. The individual, the living being, is an inseparable unity between organs and psyche or soul. Dr. Hummer makes no distinction between psyche and soul. His first book was entitled, Cancer, Disease of the Soul. But these are biological conflicts, and some say there is also a spirit or something. I never quite understood the difference between soul and spirit. We have biological conflicts, so this is also a biological language. Perhaps the simplest way to explain it is as follows: every organ, by nature, has a certain task. If I have a conflict in this task, then this organ is involved. We must first learn to understand this language. We know many expressions that hit the nail on the head: it's on my mind. Or, I've cut my teeth on this. This is the biological language. The same is true for animals. Also for the baby. In addition, there is the level of the brain. These are always synchronous. We only think of these 3 levels to be able to work with them. But there is no organ disease without a correlation in the psyche, and there is no psychosis without a connection to an organ. We always have the Hummer focus in the brain relay, either active or edematized in healing. So, we also have an overdetermined diagnostic procedure that is very, very accurate. I can always switch from one level to another. The big difference with the current therapies, according to the Medical Tribune, there are about 1,000 different therapies. Conventional medicine, Chinese medicine, Indian medicine, homeopathy, Hildegard medicine and so forth, are all different therapies. Conventional medicine is limited only to the level of the organs. The psyche, or the soul, does not interest them. Neither in the patient nor in the laboratory animal. The animal has no soul, man has practically no soul. No, it has nothing to do with the psyche, they say. And vice versa, the kinesiologists and the family constellations and so on, they only poke around in the psyche. They ignore the organ level. That's why they often play with fire. Because there are conflicts that I'd better not solve. If I recognize the conflict, and it has become meaningless in the meantime, then it will inevitably dissolve. Then I may enter a healing phase that I cannot survive. You don't know that. Or the other way around, there are conflicts that I have transformed downward. I have repressed them. The purpose of repression is to make the conflict livable. The patient with the best will is unable to remember. Now the woman is confronted with the rapist. What she has laboriously repressed flares up again. She is still unable to resolve the conflict. A conflict is only resolved when it can no longer happen again. Then she suffers a complete relapse. You are playing with fire. Of course they find the causes. But they have no idea about the consequences. This can be counterproductive, just like in conventional medicine. If you only fight the symptom and don't remove the cause, the patient remains conflicted and exhausts. He remains sympathicatonic. Or he stumbles over the track again and has a relapse. Conventional doctors are not interested in that. This is roughly how it can be explained. That is the vast difference between Germanische Heilkunde and the current forms of therapy. The therapist in Germanische Heilkunde must be a clinician. He must be able to interpret an organ CT correctly. This is often not so easy. Dr. Hummer says that it is often impossible to distinguish between ascites and a giant renal cyst from an organ CT or an MRI. Both are liquid. The renal cyst is initially surrounded only by a very thin membrane. It is important that you can recognize this thin membrane and tell whether it is a renal cyst or ascites. Only at the level of organs, it is almost impossible. So of course, there are many misdiagnoses. There is a spectacular case, where a patient was diagnosed with ascites, and then a kidney cyst was removed that weighed 45 pounds. In Germanische Heilkunde, we still have the brain CT. We can see where the Hummer focus is. Is it in the peritoneum or in the kidney? Does he have ascites or a renal cyst? Of course, we have to find the corresponding conflict in the psyche. In the case of the kidney cyst, it has even been resolved. A resolved fluid conflict. In the case of ascites, it is also a resolved attack on the abdomen. I have to find that in the patient. For this reason the diagnosis is very, very precise. What is the very big difference to the other therapies too, is the knowledge of the cause. What does a conventional physician know about the cause of kidney cancer or ascites? Nothing, no idea. What does the kinesiologist know about the cause? Nothing, no idea. The same is true for the family constellation or the homeopath. What do they know about? Nothing at all, no idea. Everyone has their therapy. And everyone treats you. The most important thing is that something is done. We are accused of doing nothing at all. In reality, we have the therapy of choice, the causal therapy. If the child responds with liver cancer because it refuses to foot the grandmother's food and suffers from the fact that mom is not there, then I give the child his mother back. For the child, a great relief comes and healing sets in. But first, you have to know the cause. This is the very, very big difference between Germanische Heilkunde and other forms of therapy. Of course, I'd rather have a homeopath on my butt than an oncologist on my face. Because the homeopath swallows his own pellets. But the oncologist doesn't swallow his own chemo. Also, the oncologist can destroy you so much that you won't survive. The homeopath does not harm you. Homeopathy has written on its banners, above all, do no harm. While the conventional doctor says, no effect without side effect. And the side effect is what you do get. From this perspective, I prefer any homeopath. But what can homeopathy do? The globule cannot solve a conflict for me. The globule cannot shorten a healing phase for me. What the globule does is. It was Voltaire who said, the art consists in making the patient wait until nature has cured him. That is the art. Now, when the patient receives a globule, he thinks, now I will feel better. It is similar to the host in the church. Your sins are forgiven. My sins are forgiven. In nature, there is no sin at all. This is an invention of the church to subjugate us, to blackmail us. Abdication. There is no sin in nature. This is all nonsense. Is it a sin if the cat eats the mouse? And now I have to forgive the cat? What nonsense. But what bothers me about homeopathy is, that I have another little globule between me and my health. What should I do if I don't get the globule? Then I panic. That's what bothers me about homeopathy. I mean, it doesn't hurt, and I have a handle. That's how people are feeling right now. They are brought up like, you have to take something and you will get better. That is possible. It takes away my fear, I have confidence in this. But I am dependent on the globule again. That is not the case with Germanische Heilkunde. If I understand Germanische Heilkunde correctly, then nothing stands between me and my health. But when it becomes acute, when it becomes critical, I need the conventional doctor, and I need the surgeon. Then I need cortisol to reduce the pressure in the brain. Then, I don't need the globules, then I don't need the family constellation. Then I need a professional, an intensive care physician. I am therefore convinced that Germanische Heilkunde will be the medicine of the future, with the emergency room as a supplement. Dr. Hummer does not only step on the feet of conventional doctors. He also steps on the toes of the homeopaths. Because they realize, for heaven's sake, if Germanische Heilkunde is true, then we have only practiced hocus pocus. I am a technician, and I don't mean any offense if I paint things a little black and white. I do not understand the principle of homeopathy. As a technician, I can't understand it. I am a mechanical and electrical engineer. I was a software engineer. But I don't understand the principle of homeopathy. They say, like with like. That is the principle of homeopathy. That is, the patient has a symptom, and then you look for a remedy that similarly causes that symptom. Then one potions that remedy. At D24 or so, there is absolutely no matter left in the dilution, just pure vibration. I think it was something like D20, D30. I have no idea. So, you take the stuff, the substance that causes similar, and you take 1 part to 9 parts alcohol. Then you shake that. Then you take another part and 9 parts alcohol and shake it, then another part and 9 parts alcohol and so on. And when you've done that 30 times, there's nothing left of the original substance. That's the theory of like with like. That means above all, that the homeopath concentrates on the symptoms, and not on the cause. He does not know the cause. The high potencies like D1000 are said to be very dangerous. I know one, the classical homeopath works with 1 or 2 globules, highly potentized, D1000. That is supposed to be very dangerous. Now comes the technician, little Helmut. Now imagine the following. Let's assume that there is a wolf cherry in Vienna. The wind carries a molecule of this deadly nightshade from Vienna to Salzburg. And this molecule from Vienna in Salzburg pushes the molecules, let's say, all the way to Munich. So, I have only the vibration, the information in Munich, of the molecule from Salzburg, which actually comes from Vienna. Then I think that I also have a D1000. We live in a sea of trillions of vibrations. When I drink tea, the water flows over minerals and rocks and picks up vibrations. Or when I breathe, I am in a sea of trillions of vibrations. Somewhere there must be a D1000, knocking me over, killing me. Here the classical homeopath immediately protests and says that it should be shaken, not stirred. And that's what homeopathy is all about, shaken, not stirred. You know it from James Bond. The martini has to be shaken, not stirred, then it tastes better. So, you really have to have an excellent sense of taste. That's where I stop with this consideration of homeopathy. I'm sorry, as a technician, I don't understand. Why would only the vibration that I shake work, and not the other vibrations? I am sorry. And then the homeopath comes and says that in this sea of trillions of vibrations, one is missing. So no, I'm sorry, that's where I get off. Like I said, compared to the oncologist, I prefer a homeopath on my butt. I also have to tell you a story about homeopathy. My wife has always been interested in alternative medicine. Not me at all, not until Olivia. To me, conventional doctors were gods, because they saved people's lives. Once my youngest, then 10-year-old daughter had a fever, that was in 2000. But a high fever. She had hallucinations, it was terrifying to watch. My father-in-law shouted at us from the first floor, "You should have taken the children away, you are not going to the doctor." My wife was shaking with fear. And we know a traditional homeopath, Dr. Loebner from Liges in Graz. He is also well known. My wife asks if she should call him. I say, call him. He prescribed to her on the phone a globule, which she also had in the house. She puts it between Elizabeth's lips. The child turns over feverishly and goes back to sleep. My wife, phew, and the father-in-law, phew. Phew, it did something, and it got quiet in the house. Really, everybody was quiet. I was very impressed by that. That's what I like about homeopathy. But again, I have the globule between me and my health. What if I don't get it? Then I panic again, and that's the wrong way to go. So, in my opinion, it makes much more sense to study how my body works. Because it works the same way as your neighbor's body. Everything works according to the 5 laws of nature. But it's very, very individual. Because your annoyance is different from mine. We both got it with our guts, but you got it with your mother-in-law, and I got it with the boss at the company. But it's an annoyance in both cases. You can learn Germanische Heilkunde, and I think that makes more sense. I know the cause and deal with it more causally. Causes of cancer. Genetic. My point here is also, that you can argue in a conversation. For example, genetically caused. Is there heredity? When you go to the doctor with breast cancer and ask, "Doctor, why do I have breast cancer?" It's genetically in you. Is there hereditary cancer or not? Of course, there is heredity. For example, 2 white people, a man and a woman, will not have a brown child. At least not that easily. That is hereditary. We also look like our parents, and our children look like us. Of course, this is also inherited. Of course, there is also genetic damage. Well, Germanische Heilkunde, it does not apply to injuries, poisoning, or malnutrition. Radiation is more like poisoning. The genetic material is damaged. I don't have to resolve a conflict about that. The liberators, the Americans, have fired uranium munitions in Iraq. The mothers there are now having children with 2 heads and deformities. That of course is irreversible. I don't need to solve a conflict about that. Hemophilia is genetic. It is hereditary. But that is about the only thing. Dr. Hummer doesn't say much about it either, because there are different blood groups. You won't read anything about it in Germanische Heilkunde, because he doesn't know anything about it. Why are there different blood groups? Even Dr. Hummer does not know everything. But if there were hereditary breast cancer, or hereditary bone cancer, or hereditary leukemia, or something like that, It would all have to go back to Adam and Eve. They must have been so sick that they couldn't reproduce. And then people say, no, it wasn't like that. Somebody started inheriting. Okay, fine. And what was the cause? Then you're back to the 5,000 hypotheses of conventional medicine. The same is true for infections. By the way, somebody must have started the infection at some point. What was the cause of the first case? You are back to the 5,000 hypotheses. There is nothing more than hypotheses. A human generation lasts 30 years. If it is inherited genetically, 1 becomes 2, 2 becomes 4, 4 becomes 8, 8 becomes 16. Then we should all be infected with cancer. That's actually true. That's the following consideration, whether you really understand Germanische Heilkunde. For example, if I suffer a stink conflict and now the nasal mucosa ulcerates, it has a cell loss. If I resolve that within 5 or 10 seconds, I have a healing phase of 5 or 10 seconds and I have to sneeze. At the end of the healing, it's good again. If I take an hour, I'll have a cold for an hour and sneeze a few times. If I had an active stink conflict for a week, I'll be snotty for a week. If I don't resolve it, I'll have nasal mucosa cancer. For the sake of understanding, the cause of nasal mucosa cancer is the stink conflict. Very acute, isolating experienced, and on the wrong foot. But there is a difference between solving it within 10 seconds and not solving it at all. If I resolve it within 10 seconds, I have to sneeze. If I don't resolve it at all, I have nasal mucosa cancer. It's basically the same thing. Sneezing, nasal mucosa cancer, the difference is the conflict load. So, what is cancer anyway? We don't talk about cancer anymore, because in our minds, it is something negative. We associate it with death. Every program has a meaning. Cancer is negative. But why should we be afraid of something that makes sense? The fifth law of nature, to me, also takes away fear. We've all had these programs running tenfold, but we've never been sick. What does the flu mean? It is the cure of some special program. Fortunately, you were able to solve it. If you hadn't solved it, you wouldn't be sitting here today. Now, what is cancer? Cancer is a name. But what exactly is cancer? How is it defined? In Germanische Heilkunde, it is defined very precisely. In conventional medicine, they have a distinctive classification of good and evil. There they randomly throw everything together. If one assumes that cancer is hereditary, how can spontaneous healing be explained? Here, conventional medicine tends to speak of miracles. Conventional medicine officially believes in miracles. In Lord, there is a medical forum at the medical faculty that examines whether the recovered person has indeed not swallowed any globules. So, he must not have done anything, only a pilgrimage to Lourdes. Then it is forwarded to Rome and officially recognized as a miracle healing. Now there are about 80 or 90 such official miracle cures. So conventional medicine officially believes in miracles. Dr. Hummer can explain these miracles. There is no hereditary neurodermatitis, and there is no hereditary psychosis, nothing like that exists. Cancer has nothing to do with heredity. Every special program starts with a Hummer focus in the brain, and this only comes about the conflict shock. This can be verified at any time by the next best case. Carcinogenic substances. What about carcinogens? An ORF, Austrian National TV, lecturer once said, he got bladder cancer from smoking. As a result, he quit smoking. I wonder, how did he smoke? Down there, or how? Or did he inhale very deeply so that he got bladder cancer from smoking? Then why did he get bladder cancer from smoking? Where is this idea that smoking causes lung cancer coming from? Mice were smoked with cigarette smoke. They responded with an increased number of lung foci. Aha, smoking causes lung cancer. Then they smoked golden hamsters. 6,000 golden hamsters were smoked, and 6,000 remained unsmoked. The smoked golden hamsters lived longer on average than the non-smokers. Smoking also has a stimulating effect. The somped beef lasts longer. This can also be explained. In the Middle Ages, people knew that there was a fire somewhere when mice ran out of a house. The mice run away in panic. On the other hand, the golden hamster is not programmed by nature to run away in panic when smoke is present. How stupid would he be? He lives underground, with flames raging above him. Passive smoking is said to be extremely dangerous. Watch out. I want to point out that all of humanity grew up around the campfire. They were all passive smokers. And in the old farms, there was the smoke kitchen. An open storeroom with a vast fireplace. And of course, people often smoked there and everything was so sooty. Yes, the smokehouse. They were all passive smokers. What if I light a fireplace, the typical fireplace? I burn wood there. What is tobacco? It's nothing but a plant. Just like wood. Then, I am also a passive smoker. I will show you how two facts can be connected. I can then prove or disprove anything, depending on what I want. The same is valid for formaldehyde. If I fix the rat's head and permanently inject formaldehyde into its nose for weeks or months, it's a pungent stench. It's an antiseptic. Normally, the rats would give that caustic smell a wide berth. They just have a conflict with the nasal mucosa, and the ulcer gets bigger and bigger. From this, the conventional physician concludes, formaldehyde is carcinogenic. If they screwed my head on and sprayed shit up my nose hundreds of times a day for weeks and months, I probably wouldn't be able to resolve the conflict either, and I'd get nasal mucosal ulcers too. But that does not mean that shit is carcinogenic. The statement that formaldehyde causes cancer cannot be substantiated. Not everyone who is exposed to formaldehyde gets cancer of the nasal mucosa, and not everyone who gets cancer of the nasal mucosa is exposed to formaldehyde. It is the same with smoking. But everyone who has nasal mucosa cancer must have suffered a stinking conflict in the psyche. He must have the Hummer focus at a very specific place in the brain. Only then can he react on the organ level with nasal mucosa cancer. I can reproduce this with me and also with the rat. Then the tar. During a lecture, a doctor and chemist once stood up and said, "Mr. Pilhar, what you are saying there is nonsense. If we put tar on the coat of the rat, it will get a melanoma. Reproducible on the first rat. If we put it on your skin, you will also get a melanoma." I say, "Doctor, I even believe you." A look in the scientific chart from Hummer. There, under melanoma, it says as a cause of defilement. The animal feels tarnished and tries to lick it off. You stick it back on. The animal cannot resolve the conflict. Then the melanoma gets bigger, bigger, bigger. But if I am permanently spit on in the same place, I may feel just as defiled and react with melanoma in that place. But that doesn't mean that spit is carcinogenic. As I said, connecting two facts, you can forget it. Or Chernobyl. What do the Chernobyl children have? Leukemia. What is leukemia? The healing phase of anemia, blood deficiency. If I radioactively destroy the bone marrow, they have anemia. If I stop the poisoning, the bone marrow tries to regenerate itself with leukemia. Leukemia is the healing phase of anemia. The same thing can be seen with the violation of self-esteem. In the active phase, the bone osteolysis, the bone marrow disappears, and I have anemia. If I resolve the violation of self-esteem, then I have leukemia. This is also what one sees in chemo patients. As long as he is treated with poison gas, he is anemic. You could also call it Chechita. He has no blood. When I stop the poisoning, the bone marrow tries to recover from leukemia. Every cancer patient signs that as a result of the radiation and chemo, they may react with leukemia afterward. They all personally sign that too. Otherwise they won't get the therapy. They have to sign, and they do. In the panic and in the fear. The oncologist paints the devil on the patient's wall, "You'll be dead in 3 months." And the patient, "Yes, yes, yes. But I have the solution, chemo, radiation, and then everything will be fine." The patient signs everything. This is not only quackery, it is a crime. Or the asbestos. These are fine needles that penetrate the lungs. They get stuck in the mucosa or pierce the cell. Then the body immediately tries to encapsulate them with connective tissue. Breathing is indeed worse. Only the connective tissue necrotizes in the active phase, and at the end of the healing phase, it is thicker than before. This is still not cancer. I mean, it's not healthy at all. But it doesn't cause cancer yet. Or frying fat is also supposed to be carcinogenic. Yes, just think about the campfires of humanity. Then people swallowed a burnt piece of meat every now and then. So, they are very inventive to scare and frighten us. In short, no substance could trigger a sensible biological special program. There isn't. I can poison myself, of course. But the Germanische Heilkunde does not apply to that. So, I can also poison myself with irradiation so that I die from it. However, I don't need to resolve any conflict. The diagnostic shock. Then this diagnostic shock. There is a Mr. Ivo Sasic in AZK, who does really great work. There is a short report about the 40 studies, whatever that means exactly. I suppose it was in the 1940s, that governments and pharmaceutical companies began to study what happens to a person when they are given a terrible diagnosis. They studied that. They know exactly what they are doing to the patient's psyche. For example, someone once locked himself in a cold room. The next day he was dead. The refrigerator was not on at all. He had simply panicked. He was convinced he was going to freeze to death. He gave up mentally and was dead. One phone call would have been enough. Hey, listen, the cooling room is not on. You'll be released tomorrow. Nothing would have happened. If I tell the patient now that he has cancer, that is a death sentence. Our fate is, we believe the oncologist. Now with Germanische Heilkunde, we see. Wait a minute, this has a certain cause. I can fix that. Or maybe I'm already in a healing phase. Why are you making me believe that I have cancer, while I'm in a healing phase? That way, I save myself the diagnosis shock. I save myself another cancer. Just by getting the information, just by making the phone call. I thought I was going to freeze to death. Thank God. I'll see you tomorrow, I can handle it. I'm in a healing phase. Oh, that takes 3 weeks? I can handle that. I thought, wow, now I'm going to die. That's a huge difference. Just the information. That is the Germanische Heilkunde. You don't have to believe anything, you can really experience it. And with time, belief becomes knowing, out of faith. If you know, then there is no panic, no fear. And there are no tracking conflicts. There is a very revealing animal experiment. They chased rats around in circles with electric shocks. After 30 minutes, they dropped dead. They took a second group, hunted them in a circle. After 30 minutes, they dropped dead. A third group is taken and chased in a circle, and after 25 minutes, a door is opened for them to escape. This group is taken again and hunted in a circle. Now they have been holding out for 40 minutes, hoping that somewhere a door will open. That's the principle of hope. If the oncologist tells the patient that he has only 3 months to live, the door is closed. They chased rats in circles with electric shocks. You will never experience that with Hummer, because you can't say for sure, at the end of the day a door is going to open. Coincidentally, the mother-in-law is struck by lightning, and things look very different for the patient. You can never say with 100%. It is also very revealing that among the Aborigines, the worst punishment was to be expelled from the clan. They knew that no one would talk to them anymore. They would go out into the prairies, lie down on the ground, and within 2 days they were dead. They had completely given up. That's what happens when you take hope away from the patient. When the doctor says the disease is incurable, settle your affairs, you have 3 months left. The patient kills himself mentally. As I said, it's pretty much the disaster of choice when the patient gives up. Next, nutrition. Food, of course, is necessary for life. Without food you die. We also emphasize good nutrition. In a tuberculosis healing you need protein, because you also lose protein. If you do a fasting cure there, you will kill yourself. You will never experience that with Hummer. Because you can't say for sure, at the end of the day, a solution is found after all. Even for the absolutely insoluble conflict with the mother-in-law. Coincidentally, the mother-in-law is struck by lightning, and things look very different for the patient. You can never say with 100%. By the way, also something interesting. What is actually lactose intolerance? So, he had suffered an annoyance conflict and reacted with the intestines. At that moment, he was drinking milk. His brain was busy with the milk at that moment. During the shock, when the Hummer focus occurred, the brain took a snapshot like a camera. Then everything the brain is busy with at that moment is stored in the DHS. Then later, when one gets on such a track, the body warns. Beware, back then, you were also drinking milk when the annoyance happened. If he drinks milk now, what happens to his bowels? He has a recurrence. In the active phase, the intestine has a cellular increase with constipation. If the milk is digested, and he comes off the track, then the tuberculosis is broken down. He enters the healing phase with diarrhea or intestinal cramps. The colic is the healing. So, what does the milk do? It causes colon cancer. Or the pollen allergy, the nasal mucosa. What does the pollen do? They cause an ulcer in the nasal mucosa. But no one would take it into their head to say, pollen is carcinogenic, or milk is carcinogenic. But the mechanism is like this. Not to mention that we can poison ourselves quite a bit through our food. With the antibiotics, they feed to the animals, the pesticides they use on fruits and vegetables, a truck carrying the bananas or the oranges. There is poison gas in these containers to kill bugs and keep the fruit fresh. So, that's not so healthy. Also, the genetically engineered crap that they feed us, that's all smear. Nobody knows what the consequences of this genetic engineering will be in the future. Apart from that, no diet can protect you from cancer. Because it can't protect you from any conflict. How is eating cereal going to protect you from your partner cheating on you? Or the child is falling out of the tree and causing you a conflict? No diet can heal you from cancer. You now have a conflict of care for your child, the lump is getting bigger and bigger. Do you think the lumps will go away if you eat cereal? No. Fortunately, there is also no form of diet which could give you cancer, because there are no carcinogens. So eat what you like. Listen to your body. It will ask for what it needs. Just enjoy the food. I was once invited by a group that called themselves Instinctor. They eat everything raw. They smell it. If it smells good, they bite into it. Even in meat, raw. That was a lecture at a campsite under a tent. There was a table with a lump of meat on it. From that, they cut slices or a piece of raw lamb. Then they wandered through the pasture and collected grasshoppers. Protein snacks. I was invited because 2 of them had cancer. They couldn't explain it. They eat everything as God created it, and they get cancer. Because it has nothing to do with diet. Cancer has nothing to do with the diet at all. 40 days of fasting. Then these 40 days of fasting. Where does the number 40 come from? From the Bible. Jesus in the desert, 40 days. One could say that during the conflict active phase, fasting is often not so challenging. You have no appetite anyway. You can die of emaciation under the circumstances. Fasting in the healing phase, then you can melt away, so to speak. Pulmonary tuberculosis. The tuberculosis patients around 1900. The hanging healing of pulmonary tuberculosis. From lung cancer and hanging healing. The body immediately removes the loss of protein from the muscles, and you lose weight. You are then skin and bones only. I can emaciate in the active phase, but I can also emaciate in the healing phase. That's when they often have problems regaining weight. To fast here, to want to starve cancer, that's the personified evil. That's how it's planted in our minds. The induced insanity. We have been told, cancer is an alien creature in our body. If I don't eat, this beast must starve. In doing so, I am killing myself. Especially in our affluent society, fasting once is definitely an experience. I have been on hunger strike twice for a few days. That is somehow an experience. How the body reacts to it. At the moment you have energy without end, but at some point, Buffett goes downhill. This downward slide, only to be able to make the turn again. I've seen a few people die with that. So, if you are fasting, do it outside the programs, if you are healthy. Not if you are in the middle of the healing phase. That can cost you your life. Maybe a word about nutrition. Don't get me wrong. Of course, a healthy organic diet without all the poison stuff and antibiotics is always better. But the fact is, that humanity has always suffered from famine. They were always happy when they had something to eat. But today, look at the supermarket or look at your table. You have everything. You have vegetables, fruits, meat, grain, you really have everything in abundance. So, malnutrition in our society is almost impossible. The anorexia, that's another program. But no diet can cause neurodermatitis or breast cancer in you, there is no such thing. Preventive measures. Sport is healthy? What are the preventive measures recommended to us by the system? Not smoking, a healthy diet, exercise. None of that has any relevance to cancer. This is somewhat funny, someone wrote me this in an email. If biking and running were healthy, then the letter carrier should be immortal. A whale swims all day, eats lots of fish and drinks only water and is fat anyway. A rabbit jumps and hops all day and only lives to be 15 years old. A turtle, on the other hand, does nothing all day and lives for 150 years. Give the people bread and games, and you can do with them whatever you want. One could say that people are on a hamster wheel. 5 days a week, 8 hours, and then the driving back and forth. When they do have free time, they have to be active in some way because they are so busy. It's a whole industry living well from this. You can see it in the costumes people wear. That's a jogger, that's a skier, a cyclist, a motorcyclist. It all costs money. That's how you keep the economy going. But it has nothing to do with cancer. On the contrary, especially children of ambitious parents who force their children to participate in sports can develop knee problems due to a sporting violation of their self-esteem. Then they get bone cancer, and then because of the sport are eliminated by conventional medicine in the most agonizing way. So physical activity is certainly not bad. A healthy diet is certainly not bad. But the way the obese are torturing themselves, that's all the wrong way. Then this early determination. Why early detection? So that the cancer is detected before it spreads. That's the purpose of early detection. Now the woman has a small lump in her breast, which would not have been worth talking about at all. Without the early detection, no one would have diagnosed it. She would have gotten healthy without knowing it. But now with the early diagnosis, every little carcinoma is detected, and then she gets the final shot, breast cancer. Then she has her follow-up conflicts and is in the machinery. Süddeutsche, May 21, 2004. On early detection, the Süddeutsche writes. Until recently, experts assumed that a series of breast exams starting at age 50 would reduce mortality. According to their estimate, nationwide mammography reduces the number of deaths by 25%. However, this 25% reflects only relative risk reduction and is therefore misleading. A numerical example demonstrates this. For every 1,000 women who do not receive mammography screening, 4 will die of breast cancer in the next 10 years. With screening, 3 out of 1,000 will die of breast cancer. It is true that 3 instead of 4 actually means a 25% reduction. But in absolute terms, based on the number of 1,000 women screened, mammography would only reduce the mortality rate by 0.1%. This must be weighed against possible disadvantages of the examination, such as exposure to radiation and the unnecessary anxiety many healthy women are exposed to. Mammography does nothing for 996 out of 1,000 women. This is a purely conventional medical argument. It's just big business, nothing else. What good is it to me if the conventional physician detects cancer in time but does not know where it comes from and has no causal therapy? What good is that to me? Nothing at all. The cure for cancer. There can be no cure for cancer. You always look for the cure. Because I can package the cure so attractively, slide it across the counter, and write out a bill. Then they look into the deepest depths of the seas and search for a cure. In the deepest jungles, they look for plants or substances. The problem is that conventional doctors do not distinguish between active and healing. Many people are diagnosed with cancer in the healing phase. How can a substance help in the active and healing phase at the same time? That is not possible. There are substances with sympathicotonic effects and those with vagatonic effects, but no substance can do both. There is no such thing. There is no cure for cancer. Even if there were such a drug. Let's say there is such a drug that can just beam my colon cancer away. Then I must still ask myself the question, is it helpful to eliminate the symptom, as long as the cause is not eliminated? Because colon cancer has as its meaning the annoyance, the morsel to digest. Does it make sense to blast away the breast cancer of the mother, which has as its meaning, more breast milk, so that the child can become healthy? As you can see, with Germanische Heilkunde we come to a very different view. This is also the paradigm shift. Does the sun revolve around the earth, or does the earth revolve around the sun? In therapy, no stone is left unturned. Let's say that you have a violent conflict, because your partner is cheating on you. Now I will give you a remedy, and it will not bother you anymore. Can there be such a remedy? I can't imagine it. The next big topic, metastases. Let's take a prostate patient who was wrongly treated by conventional medicine, and now reacts with osteolysis in the small pelvis. In conventional medicine, they cut out his prostate and then treat him with radiation, and everything else that can be done wrong. In 99% of cases, he is then impotent. However, he continues to produce testosterone through his testicles. This means that he still has a high libido, but he no longer can. Like the Amen in prayer, his body responds with a second special program, a sexual self-devaluation conflict with osteolysis in the pubic bone. So, every bone has its own conflict content, and the pubic bone is the conflict. I am no good in bed. In Germanische Heilkunde, we know that he has a common semi-genital conflict in the psyche, a Hummer focus in the brainstem, and the special program prostate. As a result of the mistreatment, he had a second conflict in the psyche, a violation of his sexual self-esteem. A Hummer focus in the cerebral medulla, and osteolysis in the small pelvis. The conventional physician explains it differently. He explains. Metastasis in the pelvis is caused by prostate carcinoma, because the cancer cells do not have to travel far from the prostate into the pelvis. That is all the logic behind it. For the statement, that the metastases in the bone originate from prostate carcinoma, he needs 3 unprovable hypotheses. Hypothesis number 1. The first hypothesis concerns the pathway. What pathway did the cancer cell choose to travel from the prostate to the bone? There are 2 possibilities. Via the blood. Krankheiten.de is a semi-official website, states. Understanding of the cause of metastasis is currently based on self-contained hypotheses. Clear scientific evidence is still lacking. For example, in hematogenous distant metastasis, no information carrier has yet been isolated in the blood that would demonstrate migration from the primary tumor. So, no one has seen this floating cancer cell in the blood. There is also no study known that can distinguish the metastasis from the primary tumor. The oncologist simply hangs the pelvic X-ray on the screen and says, "This metastasis is from the prostate carcinoma." Based on the X-ray. We once had a hand surgeon in our circle of friends, and he told us that in the hospital cafeteria, the doctors were served cooked beef. The doctors made a joke and sent the beef to the pathology department, and they also got a result. Necrotizing tissue. Under the microscope, the pathologist could not even tell that it was beef. And then the oncologist wants to say, based on the X-ray, that this metastasis in the bone is from this prostate cancer. Almost never affected by metastases are the heart, spleen, and kidneys. This is all the more surprising because these organs are heavily perfused. That's really interesting. Why do we always have metastases in the lungs, liver, bones, and never in the tip of the nose, earlobe, or little finger? With Dr. Hummer, you are going to understand this. When a poor patient is diagnosed with cancer, "I must die." Then he reacts with cell proliferation in the lungs. These are the most common so-called metastases in conventional medicine. Or here, at ORF, Austrian National TV. New technology tracks cancer cells in the body. So few things are known about this process, because the spread of cancer cells has never been observed. Look at this. When the mainstream doctor said, "It often takes years for cancer to really cause symptoms." That means it is theoretically possible that I have cancer, but I just don't know yet. But now, I am very socially minded and always donate blood. Now, a cancer cell from me in the recipient's blood can cause a distant metastasis in him. If you can transplant stem cells, then maybe you can transplant cancer cells. Or, to put it another way, is donor blood actually tested for cancer cells? Answer, no. Why not? Because they never found any. During forced chemotherapy in Olivia's case, blood was drawn every other day, because the white and red blood cells were decreasing. Basically, this is nothing more than a bleeding out, a slaughter. I asked the oncologist if they dose the chemotherapy according to the cancer cells in the blood. More cancer cells, more chemo, fewer cancer cells, less chemo? I'm a technician. He laughed at me and said, "No, there are only 2 types of cancer where we can find cancer cells in the blood, both are blood cancers. Myeloid leukemia and lymphocytic leukemia. And those are in the stages of healing. You can't find cancer cells in the blood at all." I once said that to nursing students. They were very, very skeptical. The next day they asked their professor, the oncologist, "Is that true? You have never seen a cancer cell in your blood?" He was silent for a minute. Then he hissed between his teeth, "Yes, that's true. But these are questions you don't ask as a prospective nurse. Yes, just ask the Pope about Mary's Immaculate Conception. Did Joseph really believe that? I wouldn't believe my wife. But you just don't ask such questions." Or Kretzmary of Traube. He is a German-trained oncologist. He once declared with a grin from ear to ear. The reason these cancer cells haven't been found in the blood yet is because they are so fast. One hypothesis more or less at 5,000, it doesn't really matter. So, these migrating cancer cells in the blood have never been seen. Then there is the possibility of the lymphatic vessels. If you look at the lymphatic vessels anatomically, they are all unilaterally oriented. They all drain into the venous blood, into the heart, into the lungs, back to the heart, and into the periphery. There are no lymphatic vessels in the bone. Not even in the lungs or brain. By the way, conventional medicine refers to them as settlements. So, it is anatomically impossible for the metastases to settle in the bones, in the lungs, or in the brain via the lymphatic vessels because there are no lymphatic vessels there. So, what is the way? It is suspected that it works that way, but nothing has ever been proven. Then hypothesis number 2. What kind of tissue is the prostate? It's glandular tissue, and the bone is connective tissue. Yes, wait a minute, how does the caterpillar become a butterfly? How does a glandular cancer cell suddenly change its germ layer and become connective tissue? How does the caterpillar become a butterfly? You can't read that anywhere in any academic medical book, because no one can explain this. It is simply proclaimed as dogma. One must believe it. One must repent and renounce it. Otherwise, the stake is imminent. Otherwise, you will be excommunicated. You will no longer be allowed to participate in this lucrative trade. Hypothesis number 3. What does the prostate cancer cell do? It divides. The tumor gets bigger. What does the metastasis do in the bone? It creates a hole. How is this supposed to work? What shocks me so much as a technician? Every oncologist pretends to understand this. With these 3 arguments, you can unseat any oncologist. He can no longer look at you. Then you better just turn around and leave. He is a businessman, and you just caught him cheating. They don't like that. Medical Journal, August 5, 2003. But now it's getting really colorful. Camouflage and deception on the way to the bones. A working group in Heidelberg Cancer Research Center. The heart of German cancer research. Let it melt on your tongue. Attempts to determine the molecular background of cancer cell metastasis. That sounds very scientific. Cells from breast and prostate cancers have a particular tendency to metastasize to bone. Yes, of course, if you cut off a woman's breast, she has a self-devaluation conflict. Here I am no good, not a woman anymore. Then the ribs ossify. That's logical. It's also like the amen in prayer. But how do the vagabond tumor cells manage to invade the bone environment? According to the research findings of the Heidelberg Working Group, malignant cells from the breast and prostate can disguise themselves as bone cells. This property is called osteomimicry. According to the researcher, mimicry is an effective method in the animal world. Animals or plants take on the color or movement of another, for example, toxic species, to protect their lives. Cancer cells do precisely the same thing. So, you think you see a bone cancer cell in the small pelvis. But in reality, it's a prostate cancer cell disguised. Well, these cancer cells are really very savvy. For one thing, they know they are being watched. That's why they camouflage themselves. So, that is about the craziest explanation. Increased life expectancy. Then the following. When people critique conventional medicine, they say that life expectancy has increased thanks to conventional medicine. This is also a bit of a miscalculation. Infant mortality has gone down tremendously. Infant mortality used to be very high. Today it is almost non-existent. Here is a very simple example. If out of 100 people all live to be 100, I have an average life expectancy of 100 years. If 50 out of 100 people die at birth and 50 live to be 100 years old, then I have an average life expectancy of 50 years. So, in ancient times, people lived to be 80 or 90 years old, just like we do today. With us, it is already the opposite. Because of over-medication and poisoning, life expectancy is decreasing. The German Health Insurance Fund has discovered that where the density of doctors is the highest, the most people die. Then there were some major doctor strikes. Then the mortality rate dropped so much that the gravediggers lost money and started worrying about their business. The professor studied it, after all. People also often gag with the argument, "Shut up, you didn't study that." The professor studied it. What has he studied? 5,000 hypotheses. He memorized phone books. By the way, I don't want you to fall off your faith, but Jesus didn't exist either. I could show you a nice picture of Jesus. It is Odin at the Yggdrasil, shown at the Externstein in Germany. From this Odin, they have created a Jesus. Dr. Hummer was a theologian. He came from a family of clergymen. His father was also a theologian. He says that no priest believes that Jesus really existed. But what are they studying? Incidentally, the Christian religion is special in that it claims that the symbolic figure Jesus is really the Son of God. In other words, God is incarnate on earth. In this, it differs from the other religions. But if Jesus didn't exist, what are all those masters of theology? Or all those church universities, what are they really studying? It's the same with academic medicine. There are 5,000 hypotheses to study, to memorize. ORF, February 1, 2015. This is the latest information from the cancer front. What does general science know about cancer? Cancer is mostly bad luck. This is the understanding. Bad luck. You just had bad luck. So, we let these professors study for 100 years so that they can serve us that? Bad luck? That's all they know. Cancer expert. or our revered chemo director from Vienna. He personally called my family to take Olivia to chemotherapy. He is the head of the General Hospital in Vienna, the largest hospital. He explains in an interview here. Cancer is a rear-end collision in the middle of the night. With tires without tread. With black ice. Without headlights. And with a drunk driver. The highest authority, the cancerous Pope of Austria, he knows that. Indeed, that is ridiculous. That is a disgrace in the extreme. He has been awarded every possible honorary title, if you look him up on Wikipedia, and he knows zero. He just acts like he knows everything. The emperor's new clothes. The emperor is naked and actually ugly. Where do they get the knowledge? Where does conventional medicine get its knowledge from? Animal experiments and statistics. These are the two pillars. Have you ever heard of a test animal that had cancer and was cured by conventional medicine? Well, I haven't. If they can't even succeed in animals, why do we think they can do it in us? What do we humans have in common with rats? After all, most animal experiments involve rats. And why? Because it's low-key when millions of rats are idly tortured to death. That's torture, horrible. You cannot transfer a result from one species to another. The almond seeds, for example, are edible for us humans but deadly for foxes. Or arsenic, which is not so digestible for us humans, but doesn't bother the horse at all. It gets a shiny coat if you put arsenic in its drinking water. As I said, what do we have in common with rats? That's what I like so much about the Germanische Heilkunde. That it also applies to the animal, and that the animal responds in the same way that we humans do. When I look at my Rottweiler Lady Emma, she has eyes, a nose, ears, lungs, a heart. She eats like me, and I really like to cuddle her. Why shouldn't the animal also suffer a conflict? The animal is intelligent. I can talk to the animal well. I can talk to the dog, and she understands me, and she knows exactly what I want, and I know what she wants. Often a look or a gesture is enough. If you're with an animal around the clock and through the years, you don't need to yell or anything. Then a gesture is enough, and it's clear. For both of us. The animal also has intelligence. To deny all that to the animal. I feel comfortable on planet Earth with all these creatures. In the afterlife, without animals and without plants, that must be boring. The Green, September 6, 1988. Green Club leader Petrovich invited Dr. Hummer to give a lecture in Vienna in 1988. The research results of Dr. Hummer show that fear, despair, and suffering as such are capable of causing cancer in humans and animals. The unsustainability of medical research on animals proven. We don't need that in Germanische Heilkunde. I don't need animal testing. What for? In the animals, it goes precisely the same way. Dr. Hummer says this is really a disgrace to humanity. Statistics. Then statistics is the second great pillar of conventional medicine. Smoking causes lung cancer. Sugar causes tooth decay. The sun causes melanoma. Relate two facts. Or like here. Doctor's Magazine. MS, month of birth determines the risk of disease. They asked 11,500 and 17,800 MS patients in which month they were born. The result, people born in May have a higher risk of MS than those born in November. With this approach, I can void you of the result in advance. For example, I can ask the question. Women with breast cancer, what brand of car do they drive? And I know that one will win. It's not going to be any different. Someone has to win. Let's assume it's the VW Golf. All I need is the label, Dr. MD. Emotional maturity of 12 years is sufficient. Then I can write in some columns of a medical journal. VW Golf is statistically significantly suspected of causing breast cancer. Then I can connect the dots. I can ask the question. Women with breast cancer, what brand of car do they not drive at all? Suppose it's the gold-colored, black-dotted Trabant. Then I can go on to write, gold-colored, black-dotted Trabants might avoid breast cancer. With that, I can give the Golf a death blow and promote the Trabant. That's what they're doing to VW right now. A pseudoscience like conventional medicine, which has nothing to prove but only to assert, opens the door to arbitrariness. That is dangerous. I think it is incredibly dangerous. We in Germanische Heilkunde do not need statistics. Natural laws are not 90% correct, but 100% correct. What is a scientific statement? Dr. Hummer formulated the cause of breast cancer overdetermined on 3 levels. He even formulated whether it is left or right side. He formulated, what happens as long as the conflict is active, as long as the cause is active? What happens when the cause is resolved? What happens in the healing phase? What happens in the crisis? And what will be the end of the healing? We have about 100 retrievable facts for each special program. The probability that Germanische Heilkunde is correct in the scientific sense is almost 1. And at the same time, it is infinitely human. Yes, if I succeed in making the child healthy again, because the mother can stay with her child. Conventional medicine is indeed incredibly cruel. It is wholly unscientific and incredibly cruel. Herrenberg Compact Encyclopedia. It's not science. Just look up the term medicine in an encyclopedia. It says content there. Medicine uses sciences such as physics, biology, and anatomy, but it is not itself a science. As I said before, it does not know the cause of a disease. If the conventional physician is serious, he also says that it is an art of medicine. It is to Dr. Hummer's credit that he has turned the art of medicine into a science. That is his achievement. Reproducible, even with your sneeze or your pimple. The way this man was mistreated and rejected represents the suffering of us all. Professor Niemitz, August 18, 2003. What is being withheld from us? We have to watch our family members being murdered. For the very lowest of motives. Yes, really, that is just about the very lowest. To suppress such an important discovery so watertight. Or here, Professor Niemitz from Leipzig. He wrote, according to scientific criteria, the German new medicine must be declared correct, according to the current state of knowledge and to the best of our knowledge and belief. On the other hand, conventional medicine is an amorphous mishmash from a scientific point of view, which is not even falsifiable. Let alone verifiable, due to fundamentally misunderstood, alleged, facts. So, you can't refute it, because you don't even know what to refute. Therefore, according to scientific criteria, conventional medicine must be labeled as a collection of hypotheses and thus unscientific. And, according to the best human judgment, flawed. Conventional medicine does not commit itself. If you say, Doctor, neither my mother nor my grandmother had breast cancer, he will reply, well, then it just has other causes, maybe environmental. But we can't worry about the causes, because we have to treat now. Since conventional medicine cannot be proven or disproven, it is like trying to nail a pudding to the wall. You're not going to succeed. Because it's a religion. Do you know what a scientific statement is? A scientific statement is, one thing is heavier than another. It may not be true, but it is still a scientific statement. Why is it a scientific statement? Because I can verify it. I can falsify it. Dr. Hummer only makes scientific statements. Precisely to the point. With the statement, Jesus is more powerful than Muhammad, I must believe that. I can't verify that. That is an unscientific statement. And conventional medicine only makes unscientific statements that cannot be reproduced. It is a religion. It has many dogmas. Find out the definition of a cult. Everything you read on the internet is blah, blah, blah and again blah, blah, blah. I then called the cult office. Germanische Heilkunde is also considered a cult. At the cult office, I hoped I was with an expert. I would like to ask you to define what a cult is. How can you recognize a cult? He says to me, blah, blah, blah. I said, excuse me, I also researched this blah, blah, blah on the internet. I said to him, let's do it the other way around. I'll explain to you how to recognize a cult, and you try to prove me wrong. You can recognize a cult by its dogmas. It's that simple. I said, refute me this sentence. He couldn't. Sure, that's the criterion of a sect, dogmas. Without dogmas, you can't start a cult. Let's see who has dogmas. The church, conventional medicine, the political system, the economic form, capitalism, communism. These are all dogmas. We live in a matrix of dogmas. Real science cannot have dogmas. That is the difference. Judgment, February 12, 1981. Here is also a rather revealing statement about an MS patient who experienced relief through alternative treatment. And he argued, until now, conventional medicine could not help me. This alternative treatment helped me. So, the health insurance should pay. The health insurance company, on the other hand, stated, no, we will not pay because this alternative is not scientifically recognized. Thus, he lost the case. It states, even the treatment used by the vast majority of doctors and hospitals cannot, according to the court's findings, be considered scientifically generally accepted. Since the cause of this disease has not yet been researched and any form of treatment is necessarily experimental in nature, without any proof of medical accuracy. If I don't know what the cause is, I can't logically say, no, it's scientifically recognized. And in the case of cancer, conventional medicine admits that it doesn't know the cause. How does it affect cancer patients? They say it anyway, they experiment. They call it, using a nice word, a study. You are allowed to participate in a study. A study is nothing but a human experiment, or a human experiment on children. One tries things out. And where does conventional medicine know the cause of disease? Nowhere. ZDF, June 6, 2006. Or here, Horst Seehofer, he was about the proven list. There are 50,000 drugs on the market. He wanted to create a list of drugs whose effect has really been proven. He was beaten up. The reporter asked him, how is it possible that the pharmaceutical lobby is more powerful than politics? Indeed, politicians should have a say and determine what should happen. Says Seehofer, yes, I can't argue with you. But he says the lobby is so powerful. A politician once met a boss of the Pharmaceutical Association, the supreme big boss. He had given the proven list back to the politician, shredded, and thanked him with a bottle of wine. They can continue to rake in billions at our expense and suffering. Conventional medicine research. Conventional medicine is not a science. It experiments with us and is more powerful than our politicians. Who controls them, please? They are private individuals. What if they are up to no good with us, the sovereign? Who is controlling them? Nobody. Madness, madness. The Spiegel, October 24, 2004. Then they go so far as to take parents' children away. The legal system condemns the parents, not the robbers. And the media applaud. Madness. Every 10 years, the Spiegel publishes an article critical of chemotherapy, along the lines of, we warned you anyway, poison cure without benefit. Here you can see the survival rate for patients with metastatic organ cancer in the last 26 years. For breast cancer, only 10 out of 100 are still alive after 10 years. For prostate cancer, only 10 out of 100 are still alive after 5 or 6 years. For lung cancer, only 10 out of 100 are alive after 2 years. For colon cancer, after 4 or 5 years, only 5 out of 100 are alive after 2 years. And now it comes, the conventional doctor says to you, oh ma'am, in your breast cancer, we have a 60% cure rate. He's talking about a standardized group. A standardized group means, it's retrospective. Women who had breast cancer, really only breast cancer without metastases. Because out of 100 women with breast cancer, 90 respond to have metastases, lymph nodes, bones. They all drop out of the study. The study is called breast cancer only. That means there are 10 left who really only have breast cancer. And of these 10, 6 survive in 5 years. From this, the conventional doctor constructs 60% cure rate for breast cancer. In reality, 94 out of 100 dies. He constructs 60%. He does not explain that he is only talking about standardized groups. The real serious statistics are the so-called registry office statistics. From the diagnosis, no matter what cancer, no matter what stage, see how long he lives. Clinical Oncology, May 3, 2006. That's what was done here. They followed 155,000 patients from America and 73,000 from Australia after diagnosis, and concluded that 2 out of 100 survived the 5 years. So, the therapy is pretty much dead certain. Therapeutic pillars. Steel. So, what are the therapeutic pillars of conventional medicine for cancer? Steel, radiation, and chemotherapy. With steel, they try to cut away the tumor well into the healthy tissue. If the woman has breast cancer, they often cut out the other breast too. Just to be sure. This is madness. Then there is the radiation. This is where they try to kill the cancer cells they just didn't hit with the knife in the tissue. Chemotherapy is used to try to kill the cancer cells in the blood. These are the 3 pillars of conventional medicine. Radical operation far into the healthy tissue, radiation and chemo. This brochure dates from 1995 from the heart of German cancer research in Heidelberg, the Heidelberg Tumor Center, by biostatistician Ulrich Abel. For 7 years, he collected and statistically analyzed all studies. That is, trials on humans worldwide. On the cover he writes, the analysis of the scientific studies conducted to date, that is, human trials, leads to the sobering conclusion that there is no evidence whatsoever that chemotherapy prolongs life or improves the quality of life in most organ cancers. There is much evidence to the contrary of such effects, a fact now unapologetically admitted by respected oncologists. So, if with the therapy I reduce the quality of life, shorten the life expectancy, what do I give it for? With him, one must also make an interim assessment. Of course, he did not dare to write it so openly. After 7 years, 97% of them are in the cemetery. He is a biostatistician. But he writes that chemo is indisputably successful, in which 3 cancers? That's leukemia, lymphoma, and testicular cancer, the cyst in the testicle. Successes of chemotherapy. All 3 special programs are healing phase symptoms. The leukemia of the self-devaluation conflict, Hodgkin's disease, the mild collapse of self-esteem, and the testicular cyst. In the active phase the tissue necrotizes, and in the healing phase, it is repaired. Now, when I give chemo to the patient in vagotonia, it acts strongly sympathicotonic. Patients in chemo have cold hands. Then the healing phase symptom is gone. From this, the conventional doctors construct a success. But if I was active for 3 months, I am also healed for 3 months. At some point, the effect of the chemo wears off, and then he recovers. Then he needs the next round of chemo. For this reason such therapy lasts for several months. Then there is the phenomenon that the patient has colon cancer, for example. They cut the colon cancer out, far into the healthy tissue. Next, they examine him. He has no metastases. To keep it that way, he gets prophylactic chemo. Under chemo, he suddenly reacts with lung foci, with liver foci. There I have a cell division in the active phase. That's where the chemo even increases the sympathicotonia. Why does one give chemo at all? For this reason, chemo itself is suspected of being carcinogenic. I will show you in a moment. How did they get the idea to use chemo? The conventional doctor wanted to fight the dividing cancer cell. A cell that divides is larger just before cell division, with 2 cell nuclei. Then a cell divide. Every organ has a particular regeneration. If it's above that number, then it's malignant. So, he just counts down the big cells. The more big cells, the more malignant it is. Then they remember the victims of poison gas in the First World War. They had a damaged blood count, the bone marrow. So, this poison is called cytostatic equal cell arrest. So, as long as the cell is not dividing, it is relatively protected. If the cell is dividing, the poison can enter the cell and damage it to stop dividing. Of course, the poison cannot distinguish between a dividing cancer cell and a normal cell that is dividing. It simply kills any cell that is dividing. That's why there are the so-called side effects, which are actually the main principle. To work where there is a normal high rate of cell division. In the bone marrow with the blood picture. You are immediately anemic. The mucous membranes are immediately affected, your hair immediately falls out. All of this has normal high cell division. Now they give the patient chemotherapy. He doesn't have metastases. He gets chemotherapy, and suddenly, he gets cancer during chemotherapy? Then the chemotherapy itself must be carcinogenic. Protective measures. Protective measures when handling cytostatics. This is a notice that is required to be posted. One finds it in every oncology department, but it is usually hidden behind a door. It actually states, in addition to their acute and chronic toxic effects, cytostatics have mutagenic and carcinogenic properties. In other words, gene-damaging and carcinogenic. They can also lead to the development of sequela cancers. So to want to cure cancer with carcinogenic drugs, you really have to be a strict believer. In therapeutically indicated application in patients, fertility disorders and chromosomal abnormalities have been described. Fertility disorders and genetic damage, malformation. These patients should not have any more children. In order not to worry the patient unnecessarily, they can avoid the wearing of a respiratory mask. Normally, the oncologist would have to come with a respiratory mask. Then every cancer patient would run away from him. That's why they have the nurses administer the chemotherapy. So, that the oncologist doesn't poison himself. If such a drop gets on the skin, you have a hole. With my daughter Olivia, it was injected through a catheter directly into the heart, experimentally. And we were allowed to watch, for months, BMFG, August 9, 1993. Or here, the Federal Ministry of Health. Nevertheless, it must be admitted that almost all chemotherapeutic agents used, cancer therapy, have a tumor-forming effect. Roche. A chemo manufacturer himself. The only drugs for which one consciously accepts a cancer risk, considering the severity of the disease and the associated lethal threat, as well as lacking alternatives, are, ironically, the cytostatics or cancer drugs. Patient education. They make the cancer patient sign that too. Patient education. Certain cytostatic drugs with prolonged use can increase the risk that malignant disease will reform after years or decades, for example leukemia. This is especially true if radiation therapy has also been used. So again, there are no carcinogens. The chemo is very toxic and of course, patients have follow-up conflicts. With and without chemo, they have their follow-up conflicts and their special programs running. I just wanted to show you what kind of awareness the oncologist is talking to you about this, as being the only option, but rejecting it for himself. Phase, May 7, 1995. Where does chemo come from? Phase, from poison gas to cancer drug, only 6% of all cancers can be treated. By the way, nothing has changed in the last 20 years. You can say that the mortality rate is around 95% after 5 years. You can compile the statistics easily yourself. Make a list of people you personally know who have cancer, any of them, and see how long they survive. You will come to the same conclusion. 95% are dead after 5 years. Presse. October 30, 1996. Holocaust victims with cancer. The Austrian newspaper, Presse. Initial studies showed that the people who refused the therapy mainly were Holocaust victims. The reaction to the injection, the hair loss, the vomiting, the smell of the drug, all reminded the patients of their time in the concentration camp. In the case of former concentration camp inmates with cancer, the past was cruelly brought back to life. We were also therapy refusers. What would have happened if we had been Jews? Would the Austrian state have dared to chase a Jewish child and its parents through half of Europe, capture it, and experiment on it pseudo-experimentally with poison gas? Would the Jewish parents, who only wanted to protect their child, have been tried and convicted? Would the media have applauded? That Jews should now be thrown in jail for refusing to use poison gas against their child? Or would a phone call have sufficed? But for our children, it is a duty. The child is deprived of its only protection, parental care. Our child has no lobby, no lawyer. The state is usually more caring than the birth mother. There is an Arabic proverb that says, such a person is a hypocrite. They are also hypocrites, cunning hypocrites. Just look at the German word Krebszentrum, cancer center. KZ? Huh? The German abbreviation for concentration camp. But you have to watch your loved ones being disposed of with ISO-certified poison gas, and there's nothing you can do about it. You have to watch, madness, madness, madness. Finally, another question to ponder. Why is chemo given anyway? To kill the cancer cells in the blood that no one has ever seen. Do you see the big lie? And everyone is playing along. The church, the politicians, the media. It's all against the people, it's against us. This is not a mistake. When a lie is so gigantic that no one can believe it, the best thing to do is to hide behind it. Terrible, isn't it? A very brief word about morphine. In conventional medicine, all the patient has to say is, I believe something just pricked me, and he gets morphine. Even if he says he doesn't want morphine, he gets it anyway. There are already medications where it doesn't even say morphine in them anymore. As a rule, one has pain in the healing phase. Not always, sometimes the active phase also hurts. Morphine robs a person of his self-confidence. Morphine is the injection of indifference. When grandma is admitted to the hospital and only has heart palpitations, she gets a morphine injection, and already she is done for. The patient is robbed of his sense of self. Especially when the effect of the morphine wears off, the pain returns in a subjectively more potent form, and he cries out for even more morphine. He needs strong morale. He needs a strong will. He still has to go through the healing phase. The morphine paralyzes the intestine. He was already not eating in the active phase. Now he must eat or he will starve. The fatal effect is that in the deepest vagatonia, the edema is greatest. Morphine has a direct sympathicotonic effect. In sympathicatonia, there is no edema in the brain. One must imagine this edema as a sponge that has sucked up water. The nerves and dendrites have been stretched. Now the brain relay contracts, just like a tightened rubber band, and those patients die of brain death. In the deepest vagatonia, a single dose of morphine is enough, and one is dead. That's the golden shot. There are morphine addicts. If I'm healthy and don't have a special program running, then this morphine doesn't have this fatal effect. Or if I had a traffic accident, I get a morphine shot because I have an open abdomen or something. I don't have edema in my brain. But in a healing phase like that, I have edema. But a drug addict has a problem with not getting a substance and builds up conflict load. Then he gets to the substance, resolves the problem, and he injects the same dose as always. Only now has he the edema in the brain, and that is then the golden shot. That's also how euthanasia is performed, with morphine. A pharmaceutical expert once explained it to me. The nurse knows that her shift ends at 4 o'clock. If she gives the patient that dose now, he will die at 3 o'clock. Then she still has work to do on him. If she gives him that dose, he will die at 5 o'clock, and she will be home. That's how accurate they can do it. Patients are literally thrown out. Pain is subjective. Pain is not an objective measure, it's a subjective measure. So, there is no measuring device that can measure the intensity of pain. There is no such thing. Because pain intensity is subjective, I can also influence it. You may know this from your own experience. For example, if the child hurts and cries, and the mother comes and blows on it, then it's okay again. How the experience of pain changes when I understand these correlations. A small example, I once gave a lecture, and it was a young cabinet maker. He was so enthusiastic that he immediately organized another lecture. Then we got to talking. He tells me he has a broken collarbone that won't heal. A bone that won't heal, that rings alarm bells with the Germanic healer. He has an active self-devaluation conflict. The clavicle belongs to the shoulder. He was left-handed, left clavicle. The conflict at the shoulder is, I am a bad partner for my partner. With him, it was a question of succession. Who would inherit the farm, him or his brother? The relationship between his brother and his father was not very good. It must have had something to do with the succession. Anyway, he was so enthusiastic about Germanische Heilkunde that he said to himself, the furniture business has no future in Austria. He went to Germany and trained as a naturopath. He wanted to practice Germanische Heilkunde. In Austria, we do not have naturopath status. Now he actually had to live in Germany. That made the farm meaningless for him. That was the solution for him. He came into healing and called us. He got my wife on the phone. He said on the phone, listen, Erica, I'm in pain. He had rejoiced. He knew the bone was healing now. Bone in particular is thought to cause the worst cancer pain. A toothache is one such small taste. You may know this from your own experience. Toothache, what helps there? Nothing. Often the knowledge of these correlations is the only comforting thing. If I know I was conflicted for 4 weeks, then healing will take 4 weeks. But the worst time is the first 2 weeks. The periosteum stretches, and that hurts. To the lowest point of vagatonia. With the crisis the swelling goes down, and with it, the pain. You can really say then, that the pain comes for 14 days and goes for 14 days. When I know that, then I see the light on the horizon. Then I can prepare for the healing, for the pain is a task that I have before me and that I have to fulfill. While in conventional medicine, the patient associates cancer with pain. Hoping that if the pain is gone, so is the cancer, he cries out for more morphine. This is a dead end. At some point he reaches rock bottom, gets morphine, and that's it. I'm pretty convinced that out of 100 cancer patients, if I can explain these correlations to them, 90 would not reach for morphine. But they are denied this information. They are simply told, pain and cancer are the beginning of the end. You don't have to suffer pain. There is the good morphine, and that will make it easier for you. You have the right to be free of pain. We are so good, no, you don't have to be in pain. They just put you to sleep. Just like with the dog. If it is sick, put it to sleep. Grandma is sick, put her to sleep. This is the mentality in our society. We don't have time either. Both parents work, and now the grandmother is sick. She needs 24-hour care. Who does that in such a small family? In the past, there was a big family. Soon there was someone who always kept an eye on grandma. But that's how our terrible society is. That's all for this seminar video tutorial. The next seminar is, the therapy in Germanische Heilkunde. Think again about the term therapy. What is it, or what should it be? I thank you for your interest and participation, and hope it was again informative, and you could take something home with you. I appreciate your attention, until the following seminar video. Helmut Pilhar, father of Olivia.